So I am super excited about this. I had a chance to speak to our guest speakers a few weeks ago, and I'd like to introduce our two guest speakers who are from the Arkansas Abortion Support Network. The need for access to safe legal abortion services is a global one. Threats to reproductive justice continue to grow, and now more than ever, abortion providers everywhere are called to support each other in this necessary work. And we're super excited to invite and learn from the perspectives who are the co-founders of the Arkansas Abortion Support Network. AASN is an all-volunteer nonprofit organization who work to reduce barriers to abortion access in Arkansas through three service streams. Arkansas Clinic Escorts, which with volunteers escort clinics to Arkansas's only procedural abortion clinic. Abortion Services of Arkansas, which assists clients with costs associated with the procedure, including travel, lodges, and childcare. Community outreach and education, which participates in abortion education and advocacy. AASN is founded on the belief that everyone who seeks abortion services deserves to do so free from shame, ridicule, and harassment. Abortion should be accessible regardless of a pregnant person's economic or social status or zip code. All pregnant people have dignity and the right to make their own decisions about their bodies without interference from politicians, extremists, or bullies. And it is now my pleasure to introduce this year's keynote speakers, Roz Creed and Allie Taylor from the Arkansas Abortion Support Network. I'll just tell you a little bit about them. So Allie Taylor got her start in abortion advocacy at 14 years old when her mother took her to her first counter-protest of an anti-abortion rally. Ever since then, she has been a staunch advocate for safe, legal, accessible abortion. Allie is one of three co-founders and the president of the Arkansas Abortion Support Network. She has been a clinic escort for the last 7 years. Along with AASN board members and volunteers, she's been raising money to help Arkansas pay for their abortions since 2016. Allie grew up in Fairport, New York, and transplanted to Little Rock, Arkansas in 2009. She enjoys hiking, binging her favorite TV shows, spending time with close friends, and hanging out with her favorite kitty, Stella. Roz Creed is one of the three co-founders of AASN. She retired from a 30-year career at Xerox in Rochester, New York. She and her husband moved to the Little Rock area after she retired in 2005. Roz has been a women's rights crusader since she was in college in the late 60s. She is furious to have to be fighting these battles once again. She is AASN's treasurer and the director of Abortion Services of Arkansas and AASN's Abortion Fund. Roz staffs the fund helpline on a daily basis. She is the fund administrator, pledging money for abortion after talking to over 1,600 clients since July 2016, when AASN funded their first client. She says this is the most rewarding work she has ever done. And so without further ado, I would like to welcome and pass on the mic to Roz and Allie.
Hi, can y'all hear me?
Yes, we can.
Okay, good. Because I am the technology ain't my thing. Anyway, wow, I am just thrilled to be talking to y'all today. A lot of the introduction is very complimentary and I really appreciate it, but I got to tell you, I am furious to be fighting this battle still. I dated myself when I said I fought this battle in the late 60s. I'm 72 years old and I'm tired. I'm really tired. A little bit about AASN. Pretty much everything that Kamala said is accurate. The one thing that I would like to add to it is that from an abortion fund standpoint, we are a 501c3. And for those of you familiar with tax structures in the US, you're probably not. But that means that we are a nonprofit. And so all the work that we do is done by nonprofit money, which is donated to us from friends and family. lots and lots of friends, lots and lots of family. We also do all of our escorting is exclusively at Little Rock Family Planning Services, which is the clinic that's here in Arkansas. Arkansas only has 2 clinics that provide abortion, and they're both here in Little Rock. And Little Rock Family Planning Services is a full service clinic. They not only provide the pill, but they also do procedural abortions, and that's getting ready to probably go away. So from a personal standpoint, what I do as our treasurer is I keep track of money. I pay our bills. I make sure that we're constantly in the black, and the rest of the board gets really tired of hearing, oh, we need more money. But that's pretty much been my song since I started. As the fund administrator, I staff the hotline every day, every weekday. And I used to joke that I retired and wasn't going to be working. And I'll tell you, I work harder now part-time than I did when I worked for a living at Xerox. And that was, that was a challenging job. But I make financial pledges to clinics all over, mostly the surrounding, within Arkansas and the surrounding areas. And as abortion has been stripped away from neighboring states, Little Rock Family Planning Services is doing more work now because they're doing abortions for Texans and Oklahomans, which are 2 neighboring states that we didn't used to do many procedures for. So we send clients to as close as 15 miles away to Little Rock Family Planning Services, and as far away as 1,500 miles to New York. And so one of my biggest challenges is talking to people, finding out, what the cost is going to be. I understand that when we talk to Nicole and Kemla, that there's like a standard cost regardless of gestation. And in your clinic, in the States, gestation, the longer the gestation, the higher the cost. And so we start at around $650 for 6 weeks. And some clinics go up to as high as $8,500 for 30 weeks, et cetera. So it's a huge financial burden. And those are the kinds of things that we try to help with. I really get choked up talking to our patients because I hear things from, oh, I'm just so glad to get it over with. Or you've saved my life by doing this for me, by helping me financially. Some of our clients have escaped abusive situations. Some of them just don't have the financial resources to afford reliable birth control. And I'll tell you a story in a little bit, one of my favorite stories. They're all heartwarming and they're all heart-wrenching. But in a second, I'll tell you one of my favorite stories. But I can absolutely say, without question, that this has been some of the most rewarding work that I've ever done. One of the things that I forgot to mention, we are going to have time for questions and answers at the end. Do we have any ability to take questions during our talk, or how are we going to handle that?
We could, but it's probably easier for us to take them all at the end for people.
At the end, okay.
Yeah.
All right. So if there is anything that you want to ask us about when we're finished, just kind of make note of it, and we'll answer whatever questions we can. And if we can't answer a question, you have my personal assurance that we will get the answer to you, and we'll get it back to Nicole or Kemla before too long. So, I did want to mention that. As far as a favorite story, the most depressing, I guess, situation is when there's a baby having a baby. And young girls that are 13, 14, 15, that come to us through their parents looking for help. Those are the ones that kind of like, no matter what you need, we'll help you out. And about a year ago, I was on the phone with the mom of a 15-year-old who had gone to a party she wasn't supposed to go to. Mom had told her, no, it's older kids, you can't go. Well, she went anyway. She got drunk and she was assaulted. And as a result of the assault, she was pregnant. Excuse me. And she didn't feel like she could tell her mother because she wasn't supposed to go to the party and she went anyway. And she felt like it was her fault. And all of a sudden she's at 22 weeks and it's starting to be apparent that she's pregnant, and she has a conversation with her mom. And turns out, they live in Arkansas, turns out that 22 weeks is beyond the legal limit in Arkansas. They were going to have to go out of state. And that was one of the circumstances where it was going to cost $8,500 just to have the procedure. That did not include getting there, which is about a 600-mile drive, didn't include lodging because it was going to be a 2-day procedure. Obviously, she wasn't going to go alone. So it was going to be very, very expensive. She was NAF approved, the National Abortion Federation we work in partnership with. She was NAF approved, and generally speaking, NAF will approve about half or fund about half of those kinds of situations. But I needed to help the family come up with somewhere in the neighborhood of $4,000. And because nobody told me I couldn't, I just got on Facebook and put out a plea to all of our Facebook supporters and said, you know, this is the circumstance, I need around $4,000. And practically overnight, I had pledges or checks, and I was able to get them there and get it taken care of. The really heart-wrenching part of this is the mom was 16 when the daughter was born. And she was 31 years old, and she was in nursing school trying to better her life. And she was really struggling trying to raise a daughter and being a single mom and being in nursing school. Her daughter was an A student and was planning on going to college when she graduated from high school. And had AASN, through our efforts, my efforts, been able to help her, she probably would have been in the same, the daughter probably would have been in the same or worse circumstances than the mom in 15 years. So as I was telling the mom that I had raised the money and that it was all going to get taken care of, and the only thing she needed to do was get her there, that there was money available for travel as well through another agency, she just had to get there, she started crying uncontrollably. Of course, then that made me cry. So that's the kind of thing that we do on a regular basis. And just to give you some idea of some of our statistics, we started doing this in July of 2016. And today I talked to our 1,700th client. So we're up to 1,700 today. So in those those 6 years, we've gone from 0 clients to 1,700. Just to give you an idea of how much we've spent or how much this work has grown over the years, in the second half of 2016 through 2017, we spent a total of $20,210 on 78 clients. In 2018, we spent $27,280 on 130 clients. Last year, we funded 311 clients for $83,495, and this is the really terrifying part. Since the beginning of this year, and it's not even half over, we've spent $83,283 on 215 clients. So the point is that it's not going away. The need is not going away. Our funding has increased since 2020, when I started working with Choices in Memphis, Hope Med, which is in Shreveport, Louisiana, south of here, Tulsa Women's, which is in Oklahoma, Wichita in Kansas, which is north of here, and the Hope Clinic in Granite City, Illinois. But we also send third trimester clients to Albuquerque, New Mexico, Boulder, Colorado, Washington, DC, and New York City. And I don't know how familiar you guys are with the US map, but Arkansas is pretty much in the center of the country. And south of us is Louisiana, where there's a clinic. East of us is Mississippi, where there's a clinic that we work with. A little northeast is Tennessee, which is a clinic in Memphis. Due north is Missouri, which we don't work with any clinics in Missouri because all the clinics in Missouri are Planned Parenthood clinics, and we only fund independent clinics. To the west of us is Oklahoma, and that's where we also send folks to Oklahoma, and north of Oklahoma is Kansas, where we have sent people. So it's pretty much in the heartland of the country, but we do send them as far away as New York City and Washington, DC, because they're past the 22 weeks in Arkansas, and those are the places that they can get the appointments. And it's a real shell game to try to get a 22+ week appointment in either Boulder, Colorado, Albuquerque, New Mexico, New York, or in the DC clinics. That's only going to get worse when Roe goes away. So what we anticipate when Roe goes away is the cost will go up, largely because the same number of people will be looking for abortions. There'll be fewer providers, and that's going to mean that appointments will happen later. So if I find out that I'm pregnant at 6 to 8 weeks and I call and try to make an appointment at the nearest clinic, which I'm thinking by then will either be in Illinois or in Kansas, they're going to be so busy that they won't be able to see me until 10, 12, 15 weeks, which makes it incrementally more expensive. That's going to be one of the challenges that we will face. The Granite City Clinic is 350 miles away, and it's going to take 5 hours to drive there. The Wichita, Kansas Clinic is 453 miles away, and it's going to take 6 hours to drive there. And that's prohibitive, particularly because the folks that we are working with are generally speaking low-income people, and they work hourly, and they can't afford to take a day or two off of work. And so we're anticipating that a lot of those folks will use do self-managed abortions through, quote, illegal pills. We don't know that, but we're anticipating that because that's what's happened in Texas a good bit. Worst case scenario, though, is they will drive or fly to New York City, which is 1,230 miles away. And if you drive that, it's a 19-hour trip. So we're really looking at a nightmare scenario. It's really, really going to be a challenge. And our biggest obstacle coming up is going to be money. We just are going to really need the help of the folks that have helped us in the past. And we're going to have to do a lot of fundraising. So let me turn it over to Allie, and Allie's going to talk about what our current expectations are state by state. So take it away, Allie.
Thank you. Hi, and thank you so much for having us. And I'm not 100% sure if this was mentioned in the introduction, and I don't think Roz mentioned it, but I would like to share with everyone, because it is such an amazing honor and privilege to get to do this work with Roz Creed, because she's my mom. And I couldn't imagine a better scenario. And our other co-founder couldn't join us today, but Karen Music is a good friend. So it's just amazing to be able to do this work with them. As far as kind of a state by state view of what we expect, I would like to share my screen. Oh, okay, I don't have screen sharing is disabled. Okay, that's fine. If that's something that can be enabled, I do have a map that I can share that shows the states that are expected to either severely restrict access to abortion or outright ban it.
That should be turned on for you now, Allie. Sorry to interrupt.
Oh, that's okay. Thank you so much. Okay, and can everyone see my screen now with the map with purple states? Okay. So this map is from National Network of Abortion Funds, an organization that we, AASN, is a member of, and the name tells you exactly what they are. But the dark purple states represent states where abortion will be severely restricted or flat out banned. And I put my little pointer here. This is Arkansas, as Roz mentioned, pretty much close to smack dab in the middle of the country. And then we have Louisiana, Texas, and Oklahoma. Texas, as I'm sure most of you or all of you know, in September of last year, they were able to successfully pass what they call a heartbeat ban, which basically amounts to a 6-week ban. There are still some clinics that have been able to continue providing abortions up till that point, but the vast majority of Texans who are in need of abortion services have been traveling. They have been coming to Arkansas, they've been going to Louisiana Illinois. I'll put my cursor over Illinois right now, which is one of the light purple states, which is expected to maintain abortion access. Out of the dark purple states, there is a number that varies a little bit. I've read a few different iterations. Some reports say 11 states, some reports say 12 states, but at least 11 of these dark purple states, and Arkansas is one of them, have what's called a trigger law, which means there is a law on the books right now that says the moment that the Supreme Court overturns Roe v. Wade, which is the decision that makes abortion a constitutionally protected medical procedure, and has been for almost 50 years now. At any rate, the trigger laws say that when Roe v. Wade is overturned, abortion will be instantly outlawed in those states. So that is what we are anticipating to happen in Arkansas as we wait for the final opinion in the abortion case that is with our Supreme Court right now. I believe the other states that have trigger laws, mostly they're going to be the southern states. And I'm sure that there's a few of the Midwestern states that also have these trigger laws. So that's about 11 or 12 of the states. All the rest of these dark purple states have been identified as having legislatures who are hostile to abortion access, hostile to abortion legality. And so the remaining states are expected to pass laws banning abortion very shortly after Roe v. Wade is overturned. But like I said, in Arkansas, we are anticipating that the day that Supreme Court decision comes down, abortion will be outlawed right then and there. And I know that Little Rock Family Planning Services, which we refer to as our clinic, is, you know, they are working to make sure that they don't overstep when Roe v. Wade is overturned, but they're also working to figure out ways that they can continue to provide some type of help, you know, and that remains to be seen exactly what that will be. Obviously, they won't be able to provide procedures anymore, but they are hoping that they'll be able to provide at least for the referrals or information or things like that. We don't know for sure the states that don't have trigger laws. You know, it could be anytime, who knows, those legislatures might decide to implement abortion bans right away. There's still the process that most state legislatures have to go through, where they introduce a bill and one chamber votes on it, then another chamber votes on it, then the governor has to sign it. Some states have processes where any bill that is passed has a waiting period of, usually it's about 90 days before it goes into effect. But a lot of legislatures also have contingents or the ability to say, nope, this law we are passing is going to go into effect immediately. Some legislatures may not even be in session right now. For instance, Arkansas state legislature is not in session. It doesn't matter for us, of course, because of the trigger law. But of those states that we're expecting to ban abortion but do not have a trigger law, you know, we could see abortion banned in those. It could be anywhere from a month after Roe v. Wade is overturned to 6 months, depending on their processes. So not only is the prospect of having about half the country banning abortion terrifying, it's also incredibly frustrating because nobody knows exactly when anything is going to happen in various states. We're just waiting for the Supreme Court to hand down their decision. And so that's a little bit about kind of a state by state. I will go ahead and stop my share right now and also talk a little bit about some organizations that we work with who are going to be really integral to helping Arkansans when abortion is no longer accessible in Arkansas. There is an organization called the Bridget Alliance, and their main purpose is to assist folks who are having to travel for later abortion procedures. And as Roz mentioned, once there are only clinics in about 24 states in the U.S., those remaining clinics are going to get backed up, and a lot of folks from the states where abortion has been banned are probably going to be pushed into somewhat later or later abortions. So I expect that Bridget Alliance is going to have a lot of demands on their services. They help people. They don't provide funding for abortion, but they do provide funding for travel and lodging for those folks who have to travel. There is another organization called the Midwestern Access Coalition, and they help basically anybody in the Midwest or traveling to the Midwest to access abortion. And since that Granite City, Illinois clinic is going to be one of, I believe, if not the closest, one of the closest clinics to Arkansas, and there's no waiting period. That's another thing. A lot of states with many abortion restrictions already have 24-hour waiting periods, 48-hour waiting periods, or like Arkansas, we have a 72-hour waiting period. So there's one tiny sliver of good news is the folks going to Illinois won't have a waiting period. It'll just be one day, there and back. But we don't know how many patients that clinic is going to be able to handle. But Midwestern Access Coalition, we are getting in touch with them and developing a relationship with them so that we know best how to access their services for our patients, for our clients. There is also an organization called the Apiary Collective, and they are an umbrella organization for practical support organizations like Midwest Access Coalition. So they are similar to the National Network of Abortion Funds, but they focus solely on the practical support organizations. So those organizations that just provide, or in addition to abortion funding, they provide assistance with travel and lodging. Because that really is, our primary focus is funding the procedures. We do anticipate the need to increase our typical funds, typical pledges, for the possibility of people accessing later abortions, which can get more expensive. And also we are hoping that with increasing our pledges to each patient, we'll be able to offset the cost of travel and lodging. And when we're not able to fully meet the needs for those clients, we will get them in touch with those other practical support organizations. So the Apiary Collective has been holding regular calls, which unfortunately I haven't been able to join, but our other co-founder Karen has. And they've been amazing in connecting organizations with resources like digital security and grant funding, things like that, or how to, grant writing and finding grants. So they've been really instrumental in ensuring that all of these organizations who are spread out all over the country, who are going to need to be working in tandem with each other a lot more once Roe v. Wade is overturned. Apiary Collective has been really instrumental in connecting those groups, and they work with National Network of Abortion Funds to make sure we're all aware of what organizations are out there to help the folks who we're going to have to be sending out of state. And that is, I think there was a third topic I was going to cover too. If you could check your notes, what was that?
Yeah, we were going to talk a little bit about what you can do as Canadians to avoid this happening to you, because we never in a million years dreamed that abortion was ever going to go away in this country, in one state or in 26 states. So there's some suggestions that Allie and I have kicked around with our board, and Allie's going to talk about that for a minute.
Yeah, it's difficult to say or provide, I think, exact directives, especially because the Canadian legislative system is a little different from the US system, but my main suggestion is that, if I recall correctly from hearing about a conversation that Mom had with a few of you, that while abortion is perhaps not the wedge issue for Canadians that it is for Americans, that you do still have right-wing extremists in your country. You do still have an anti-abortion faction. And my best suggestion is that anytime there is even the slightest rumbling of anti-abortion legislation, whether it's being brought up perhaps in a province or at a national level, again, depending on how your system works. If you hear even the suggestion, I suggest just do everything you can to squash that immediately. We have been hearing for decades now, and especially for the last 10 years, people really, really deep in the abortion rights movement have been sounding the alarm that abortion access is in jeopardy. Roe v. Wade is in jeopardy. And people outside of the abortion rights movement, and heck, even some people inside the abortion rights movement, have been saying for years now, oh, don't be silly, you're being alarmist, we would never outlaw abortion here. Roe v. Wade, it's been precedent for almost 50 years. Our Supreme Court would never do that. And well, now we have a 6-3 conservative majority, with 3 of those newer Supreme Court justices being placed on the court specifically because it was known that they would vote to overturn Roe v. Wade. And now here we are, after years and years and years of advocacy and legislative efforts by anti-abortion activists and politicians, and we are exactly where the abortion rights advocates said we would be, when, again, so many people were saying it's alarmist, you're being silly, don't worry about it. And gradually over the last 10 years, state by state, states were taken over by much more conservative legislators. And even when they don't necessarily reflect the will of the state, once they're in the state house, they pass laws banning abortion. And now a case has gotten to the Supreme Court. So my point is that whether it's through advocacy groups, whether it's through encouraging patients to learn about abortion rights and be aware of any of those rumblings about introducing anti-abortion laws, just make connections with people all over the country to make sure that, I'm sure there are probably more conservative provinces, keep in touch with folks in those areas, and just advocate if you're able to, or if you have folks in your organization, or even kind of folks involved with your organization who are able to testify about why abortion needs to remain illegal, needs to remain legal and accessible, whether that be at legislative hearings or even holding events in public, public speak outs, people talking about their experiences of abortion, how abortion helped them live the lives that they wanted to live, how abortion saved their lives, because we know that it does. Do not brush off those rumblings, anytime you hear anything about the possibility of outlawing abortion, don't brush it off, and don't let other people tell you to brush it off. That is my
The other thing that I would add to that is keep the focus on healthcare. Canadians are very lucky because you have universal healthcare, and that really matters. If Americans were all eligible for the same healthcare, I don't think we'd be in this mess. So keep the focus on healthcare and not on choice. It is a choice, it is an optional procedure, but it is nevertheless healthcare. And I think that's something that's very important, along with squash the noise whenever it comes up. If we had done those 2 things 10 years ago, I don't know, but I'm pretty sure we wouldn't be here because some 70% of Americans think that abortion is a right. So, you know, keep the focus there. Allie, did you have anything else you wanted to add before I try to wrap it up? Okay. I think we're done unless there are questions. So questions?
Hi, thank you so much. I know that there are a few questions, and I think that our comms people will read those out. So I saw in the chat there were a few.
Okay.
Okay, hi everyone. Can you hear me okay?
Mhm.
Yeah, great. All right, we do have a couple of questions. The first one is, so we're hearing about a march, you know, as people often do around these things. What else can people do to prevent Roe v. Wade legislation from being overturned?
At this point, not much. It's in the Supreme Court. The Supreme Court has made the decision. They're going to announce it before the end of June. There's not much we can do to keep it from being overturned. The good news is it goes back to the states. And so with the upcoming election, our midterm election, the more candidates that get elected that are on the correct side of the abortion issue, they can change state laws. So for instance, in Arkansas, we have the trigger law that says immediately ban it. That law could be overturned if enough Democrats get elected this coming election. But Roe v. Wade is going away. There's nothing we can do about that. Allie, do you want to add something?
Yeah, I would say, you know, basically it's hope. You know, there have been, as you noted, lots and lots of demonstrations, both before, but especially after the leaked opinion came out. And, you know, demonstrations, there's always a chance that could influence how the Supreme Court justices vote, but it's not something to count on. They claim to be, you know, immune to public opinion. They're not as human beings, of course, but the positions dictate that they're supposed to be immune to public opinion. So as far as preventing the overturning of Roe v. Wade, there isn't anything that can be done directly, but yeah, I would agree with Roz that the next best thing to do is to start getting more abortion rights, more supporters of abortion rights into our legislatures at the state level. And I'll just throw in that I don't know exactly where this number comes from, but I have seen abortion rights advocates throwing out the concept that it'll probably be about 10 years for us to correct this as far as for the entire country. Are there individual states that might turn Democratic within the next year or two and undo their anti-abortion laws? Probably, but as far as actually correcting this on a national level so that every American has the legal right to access abortion, folks are anticipating that'll be about 10 years.
Thank you so much. And actually, talking about the individual states is a segue into our next question. Have there been rumblings on whether more clinics plan on opening up in the states that aren't expecting to ban abortions? So in other words, where the states where you can access abortion, is there any movement towards opening more clinics?
Probably. It's going to be a question of where they're going to get the staff, where is the location of the clinic going to be. I sort of envision a line that goes across all of the state lines at the southern part of the state or the eastern part of the state or the western part of the state. But that's going to take time too, because you got to find a location, you got to find a staff, you got to find the depending on the state, you've got to find a physician or a nurse practitioner that can do the procedures. But yeah, that is absolutely something that is going to happen, but not immediately.
Allie, do you have anything to add to that?
Not particularly. There have been definitely mentions, but yeah, the timeline is up in the air, and we absolutely expect. Yeah, I do expect that, you know, a border particularly in Indiana. I'm sorry, in Illinois, most likely. Yeah, it'll be. I don't know what liquor laws are like in Canada, but in the States, we have something known as dry counties. So a county being sort of a subset of the state, and a county might be dry, but if you look at the county borders, there are liquor stores just dotting the border in other counties. So yeah, the kind of, it's not a joking matter, but the joke has been that, yeah, in states where abortion is still legal, the borders are going to be popping up with new clinics, hopefully within the year.
Great. Thank you both for your answers, and thank you to our attendees who asked questions.
And I just want to say thank you so much for being with us today, for the work that you do every day, and for sharing your experiences and insights with us. I think, you know, like as I said earlier, we can never, and you would just really reaffirm this, you know, like we can never take for granted the rights and privileges that we have. And in fact, we need to never take our foot off the gas, right, in terms of working to ensure that not only do we continue to enjoy these rights and privileges, but that those rights and privileges are available to everybody, regardless of their circumstance, wherever they are, whatever country they're in, whatever community they belong to, whatever their circumstance. So much that you said has been really eye-opening. I know I had a conversation earlier with Roz, and it was eye-opening, but this has also been really eye-opening. I think seeing that map, you know, really just that visual representation really makes it so obvious, you know, and yeah, it's just, like you said earlier, it's incredible to believe that we are having this conversation again in 2022, right? And it's you know, makes me really angry, makes me really frustrated, sad, all sorts of things, you know. And as Canadians, like you said, we can never take that for granted, right? Because like you said, those voices, those conservative voices who fundamentally want to restrict women's rights, you know, and people's rights and people's access to making their own choices that are the best for them, are out there. They're in our communities, and again, yeah, like you said, we can never take those things for granted. And so I just want to thank you again so much for being with us today. And I hope that we can keep in touch. And if there's things that we can do to support you, you know, as we move towards this, you know, please don't hesitate to reach out. And yeah, and again, so thank you so much.
Thank you.
You're very welcome. Thank you.